What if the most dangerous illness you'll ever face doesn't come with loud alarms, but with whispers? A little discomfort in your stomach. A sense of tiredness that won't go away. A few pounds lost that you can't explain. It's easy to brush these off. We've all done it. But sometimes, the body is trying to tell you something before it's too late. Pancreatic cancer is one of the most aggressive and elusive diseases known to medicine. It doesn't always start with sharp pain or visible changes. Instead, it hides in the background, while silently advancing. And that's what makes it so deadly. But here's the good news: recent studies have uncovered a series of subtle, early symptoms that could help detect this disease sooner than ever before. In today's video, we're going to walk you through 15 early signs of pancreatic cancer, each one grounded in science and clinical research. Some of them might sound familiar. Others may surprise you. But all of them matter. So if you or someone you love has been feeling off lately, this could be the video that brings clarity and hope. Stick with us until the end, and if this message resonates, don't forget to like, comment, and subscribe for more truth-backed health content. Let's begin. Symptom 15, general malaise. You know that nagging feeling, when you just don't feel right, but can't quite explain why? It's not pain. It's not exhaustion. Just a persistent sense that something in your body feels off. Doctors call it malaise. And while it may seem vague or harmless, for some people, it's actually the body's quiet cry for help. A nationwide study conducted in Sweden examined over 18,000 cases of pancreatic cancer and found that general malaise and unexplained fatigue were among the top 3 symptoms noted in patient records at the time of diagnosis. These weren't dramatic complaints, they were quiet observations, yet consistent enough to be flagged across thousands of medical charts. Adding to the evidence, a separate large-scale study in Canada found that individuals reporting unexplained malaise were 2.1 times more likely to be diagnosed with pancreatic cancer within a year, compared to those who didn't report this symptom. That's a significant association, and a powerful reminder to listen to your body, even when it whispers instead of screams. Malaise is nonspecific. It can show up with viral infections, stress, or age-related changes. But if you're over 60 and have been feeling unwell for weeks, or even months, with no clear reason, don't ignore it. Pancreatic cancer is hard to detect early. That's why catching subtle signs like this can truly make a life-saving difference. Symptom 14, fatigue. Fatigue caused by pancreatic cancer isn't just about feeling worn out. It's a crushing, relentless exhaustion that lingers no matter how much rest you get. Patients often describe it as an overwhelming drain on their energy, one that makes even simple daily tasks feel impossible. At a leading oncology center in northern Italy, a staggering 94% of pancreatic cancer patients undergoing chemotherapy reported battling this intense fatigue. That number alone speaks volumes. Interestingly, this symptom hits some groups harder than others. Older adults and women were more likely to feel completely depleted. Conditions like anemia, significant weight loss, and smoking only made it worse. But what's behind this level of exhaustion? Part of the answer lies in the disease itself. Pancreatic tumors can release inflammatory substances that throw the body's internal balance into chaos, triggering fatigue. On top of that, treatments like chemotherapy, while crucial, often damage healthy cells, causing side effects like anemia that further drain energy. This kind of fatigue isn't just a nuisance. It affects quality of life, treatment adherence, and even emotional health. That's why it must be addressed. Doctors can take steps, like managing anemia, improving nutrition, and encouraging gentle physical activity to help patients regain some strength. Routine fatigue assessments and early interventions are essential, because no one should have to face cancer feeling completely powerless. Symptom 13, fever. Could a mild, lingering fever be something more than just your body fighting a cold? In rare cases, it can be the body's way of waving a red flag. Persistent low-grade fever, especially when no other symptoms are present, may be one of the earliest, and most overlooked, signs of pancreatic cancer. There was a striking case of a patient with pancreatic adenocarcinoma whose only symptom was fever. No pain. No digestive issues. Just that stubborn temperature that wouldn't go away. After surgery to remove the tumor, the fever vanished within 4 days, and it never came back, even after more than 3 years of follow-up. It wasn't an infection. It was the tumor triggering an immune response, a phenomenon doctors call neoplastic fever. And this isn't just one isolated story. A massive study of Danish health records uncovered a pattern. Fever was one of the significant symptoms reported in the 5 years leading up to a pancreatic cancer diagnosis. It may be rare, but it's real, and it matters. So if you've been running a mysterious low-grade fever that refuses to quit, and especially if it's paired with other warning signs like weight loss or fatigue, don't ignore it. Talk to your doctor. Because sometimes, the body whispers before it screams, and catching cancer early could make all the difference. Symptom 12, itchy skin. In pancreatic cancer, persistent itching can be more than just a skin issue. It often signals deeper problems. This discomfort typically arises when tumors obstruct the bile ducts, leading to a condition called cholestasis. Here, bile acids and other substances accumulate in the body, irritating nerve endings and causing that relentless itch. Recent studies have shed light on this mechanism. A 2025 review in Quality in Sport highlighted that the enzyme autotaxin plays a pivotal role. Autotaxin increases levels of lysophosphatidic acid, a compound that activates itch-specific nerve fibers. This means the itch isn't just a surface sensation, but is driven by complex biochemical changes within the body. Traditional antihistamines often fall short in providing relief because this type of itch isn't primarily histamine-driven. Instead, treatments targeting bile acid accumulation or autotaxin activity such as bile duct decompression or specific enzyme inhibitors have shown more promise. Understanding this connection is crucial, as addressing the underlying cause can significantly improve a patient's quality of life. Symptom 11, blood clots. When you think of pancreatic cancer, blood clots probably aren't the first symptom that comes to mind. But in some cases, they can be the very first warning sign, appearing even before any digestive issues arise. This condition is known as Trousseau syndrome. It's when blood clots form in unexpected places, like the arms or chest wall, and they tend to come back or shift to different areas of the body. It happens because pancreatic cancer can trigger a hypercoagulable state, where the blood becomes unusually prone to clotting. A recent study published in Cancer Medicine analyzed 3,500 pancreatic cancer patients and found that approximately 5.1% of them developed venous thromboembolism, VTE, within 6 to 12 months prior to receiving their cancer diagnosis. That number might seem small, but it's significant, and even more concerning. The presence of VTE was linked to a 32% lower survival rate compared to patients without clotting events. If you or someone you know suddenly develops a blood clot without any clear explanation, no surgery, no extended immobility, no hereditary clotting disorder, it could be more than a random event. It could be your body's early warning. And when it comes to pancreatic cancer, paying attention to the unexpected might just save a life. Symptom 10. Sudden onset diabetes. If you're over 50 and have recently been diagnosed with diabetes, chances are it's been labeled as type 2, and in most cases, that's exactly what it is. But here's the part that few people talk about. Sometimes, that new diabetes diagnosis is actually a red flag for something far more serious. In rare cases, this sudden spike in blood sugar isn't just about lifestyle or genetics. It's your pancreas sounding an alarm. Tumors in the pancreas can quietly interfere with insulin production, causing blood sugar levels to rise. And the data is clear, about 0.8% of individuals over 50 who develop new onset diabetes may actually be harboring pancreatic cancer. Even more revealing, around 25% of patients eventually diagnosed with pancreatic cancer were told they had diabetes within the 3 years leading up to their cancer diagnosis. In other words, for some people, cancer comes first, and diabetes is the warning sign. So what does this mean for you? If you've recently developed diabetes after age 50 and you're also noticing unexplained weight loss, fatigue, or other unusual symptoms, don't brush it off. Talk to your healthcare provider. Early detection of pancreatic cancer could mean the difference between catching it in time or not. Symptom 9. Pale or grayish skin. Have you ever looked in the mirror and felt like something about your skin just didn't seem right? A pale or grayish tone, especially when it shows up suddenly, could be more than just a sign of fatigue. It might be your body's way of warning you about something serious. When a tumor forms in the head of the pancreas, it can block the bile duct. This causes a buildup of bilirubin in the blood, a substance normally excreted by the liver. When bilirubin levels rise, it doesn't just stay in your bloodstream. It begins to settle in your skin, turning it yellow, pale, or even gray, especially noticeable in people with lighter skin. A major study published in Clinical Gastroenterology and Hepatology found that signs of bile duct obstruction, like jaundice, pale stools, and dark urine, were significantly more common in patients with pancreatic cancer compared to healthy individuals. These visible changes are often among the earliest clues the body gives. So don't ignore what your skin might be telling you. If you notice an unusual shift in your skin color, whether it's yellowing, pallor, or a dull gray tone, especially if it appears suddenly, speak to a healthcare provider right away. Because in the fight against pancreatic cancer, early detection can make all the difference. Symptom 8. Muscle wasting. This isn't just about shedding a few pounds. It's a profound involuntary weight loss that primarily affects your muscles, leading to weakness and fatigue. What's alarming is that this muscle wasting can start even before a formal diagnosis is made. A study published in Nature Communications in 2023 found that skeletal muscle loss could be detected up to 18 months prior to a pancreatic cancer diagnosis. This suggests that muscle wasting isn't just a side effect, but could be an early indicator of the disease. Now, you might wonder, why does this happen? Pancreatic tumors release certain substances that disrupt the body's normal metabolism. One such substance is the pancreatic adenocarcinoma upregulated factor or PAUF. Research has shown that PAUF can directly cause muscle cells to break down, leading to muscle atrophy. This isn't just about feeling weak. Muscle loss in pancreatic cancer patients is linked to poorer outcomes and reduced survival rates. It's a significant factor that affects not only the quality of life, but also the effectiveness of treatments. Understanding this connection emphasizes the importance of early detection and comprehensive care in pancreatic cancer. If you or someone you know is experiencing unexplained weight loss or muscle weakness, it's essential to consult a healthcare professional. Symptom 7. Constipation. When the pancreas isn't functioning properly due to cancer, it can disrupt digestion. This disruption may lead to slower movement of food through the intestines, resulting in harder, drier stools that are difficult to pass. Pain medications, especially opioids, often prescribed for cancer-related pain, can further slow down the digestive system, exacerbating the issue. A recent study published in 2024 in Frontiers in Oncology utilized Mendelian randomization analysis and found a potential causal relationship between constipation and an increased risk of pancreatic cancer with an odds ratio of 1.56. This suggests that persistent constipation might not just be a symptom, but could also be associated with the development of pancreatic cancer. If you're experiencing ongoing constipation, especially if it's accompanied by other symptoms like abdominal discomfort or weight loss, it's important to consult a healthcare professional. Early detection and intervention can make a significant difference. Symptom 6. Fatty stools. You might notice your stool becoming pale, greasy, or floating. This occurs because the pancreas isn't producing enough digestive enzymes, leading to fat not being properly absorbed. As a result, the unabsorbed fat passes through your digestive system, causing these noticeable changes. A study published in the Nutrition and Clinical Practice Journal in 2024 highlighted that, when over 90% of the pancreas's exocrine function is lost, fat malabsorption can lead to steatorrhea. This means that significant loss of pancreatic function can result in these stool changes. If you're experiencing these symptoms, it's essential to consult with a healthcare professional. They can perform tests to assess pancreatic function and determine the appropriate course of action. Early detection and management are key to addressing any underlying issues effectively. Symptom 5. Diarrhea. When your pancreas isn't working right, it can mess with your digestion in a big way. One of the signs: frequent loose stools that are hard to control. This happens because the pancreas makes enzymes that help break down fats, proteins, and carbs. If a tumor blocks these enzymes from reaching your intestines, your body can't absorb nutrients properly. As a result, food moves through your system too quickly, leading to diarrhea. A study published in the American Journal of Gastroenterology highlighted a case where persistent diarrhea was the only clue leading to a pancreatic cancer diagnosis. The patient had no other typical symptoms like jaundice or weight loss. This underscores how diarrhea, often overlooked, can be a critical warning sign. If you're experiencing these symptoms consistently, it's essential to consult a healthcare professional. Early detection of pancreatic issues can make a significant difference in outcomes. Symptom 4. Indigestion. Indigestion is something most of us shrug off. A heavy meal, a stressful day, it happens. But what if it keeps happening? What if that discomfort after meals doesn't go away? It could be more than just an upset stomach. In the case of pancreatic cancer, tumors can press against nearby organs like the stomach or small intestine, slowing down digestion. This pressure causes food to linger longer in the stomach, leading to symptoms like bloating, nausea, or even a burning sensation that feels eerily similar to heartburn, but without the acid. Here's what's important: research has shown that persistent indigestion, especially when it occurs without typical heartburn, could signal a much higher risk of pancreatic cancer. One large study published in BMJ Open found that people experiencing indigestion without heartburn had a 3.8 times greater chance of being diagnosed with pancreatic cancer than those without these symptoms. That's why it matters. If you've been dealing with indigestion that just won't go away, or that seems to worsen over time, and it doesn't respond to your usual remedies, don't ignore it. especially if it's paired with other red flags like unexplained weight loss or fatigue. Catching pancreatic cancer early is incredibly difficult, but it starts with noticing the small things, like a stomach that just doesn't feel right anymore. Symptom 3. Bloating. Ever felt that uncomfortable swollen sensation in your belly after eating? For some, it's just a passing discomfort, but for others, especially when it lingers, it might be signaling something more serious. In a comprehensive study conducted in the San Francisco Bay Area, researchers found that 25% of pancreatic cancer patients reported experiencing unusual bloating compared to just 2% of individuals without the disease. This translated to an odds ratio of 20, indicating a significantly higher likelihood of bloating among those with pancreatic cancer. So what's behind this bloating? The pancreas plays a crucial role in digestion by producing enzymes that help break down food. When a tumor disrupts this function, it can lead to digestive issues, causing food to remain in the stomach longer than usual. This delayed gastric emptying can result in that persistent bloated feeling. If you're experiencing ongoing bloating without a clear cause, it's essential to consult with a healthcare professional. While it might be nothing serious, it's always better to be proactive when it comes to your health. Symptom 2. Loss of appetite. Imagine sitting down to your favorite meal, but the thought of eating makes you feel sick. This isn't just a bad day. It's a reality for many facing pancreatic cancer. The pancreas plays a crucial role in digestion by producing enzymes that help break down food. When cancer affects this organ, it can disrupt enzyme production, leading to malabsorption. This means your body isn't absorbing nutrients properly, making eating feel pointless. But there's more to it. Pancreatic tumors can release substances that interfere with appetite regulation. These substances can alter signals in the brain, making you feel full even when you haven't eaten. It's like your body's hunger cues are being hijacked. A 2019 study published in The Oncologist found that up to 85% of pancreatic cancer patients experience significant weight loss, often linked to decreased appetite and malabsorption. This isn't just about feeling less hungry. It's a complex interaction between the tumor, digestive system, and brain. If you or someone you know is experiencing a persistent loss of appetite, especially alongside other symptoms like weight loss or fatigue, it's essential to consult a healthcare professional. Early detection can make a significant difference. Symptom 1. Abdominal pain. Pain in the upper abdomen that radiates to the back is a common symptom of pancreatic cancer. This discomfort often intensifies after eating or when lying down and may be alleviated by leaning forward. The pain arises due to the tumor pressing on or invading nearby nerves and organs, leading to a deep gnawing sensation. A study published in the Journal of Gastrointestinal Surgery in 2001 found that patients with pancreatic tumors, invading the anterior pancreatic capsule and intrapancreatic nerves experienced more intense abdominal pain. The severity of this pain was also associated with larger tumor sizes and lymph node metastasis. Notably, the study reported that patients without pain had a median survival of 29 months, while those with severe pain had a median survival of only 9 months, highlighting the prognostic significance of pain intensity in pancreatic cancer. If you're experiencing persistent abdominal pain, especially if it's accompanied by other symptoms like weight loss or jaundice, it's important to consult a healthcare professional for a thorough evaluation. You've just learned that some of the most overlooked symptoms, things we often dismiss as minor, can actually be early warning signs of one of the deadliest cancers out there. But now you're armed with something powerful: awareness. Remember, early detection saves lives. Listening to your body, asking the right questions, and not settling for "it's probably nothing" could make all the difference for you or someone you love. If this video opened your eyes, imagine how many others it could help too. So don't keep this knowledge to yourself, share it, comment your thoughts, and most importantly, subscribe to our channel for more science-backed, life-saving health content every single week. We're here to help you stay informed, stay strong, and take control of your health, one video at a time. Thank you for watching, and take care of yourself.